Imaging adult hip and groin. The objective of this presentation is the differential diagnosis of groin pain and role of imaging in groin pathologies and adult hip. The imaging includes a diagnosis of the OP adductor enthesopathy, diagnosis of other pathologies like stress fractures, and guide interventions. Let's see how we scan for hip joint first. So first we have the protocols. We start it while the patient is lying supine, and we take a linear transducer. We prefer to have about 7.5 to 10 megahertz linear array transducer. The head will be upward, as we can see here. This is how we hold it, and we start from the anterior of the hip. We usually scan the anterior, posterior, lateral, and anteromedial aspects of hip joint. Once we put our transducer here at the hip, interior of the hip, we will see these structures. These are the muscles. Then we have got the head of the femur. This is the green one is acetabulum, and the pinkish color is given to the labrum, which is a cartilaginous structure. This is how it appears, the femur, and we can see the head of the femur. This is acetabulum. Here, this is the acetabulum, and here is the labrum. In another view, you can see the labrum. In this case, we had a small strain in this patient in some of the muscles in the anterior compartment. We will discuss while discussing pathologies. Then is when we go towards the lateral aspect. From the lateral side, we can see a part of the upper part of the shaft of femur with the head will be on this side, and we can see the greater trochanter. Here it will be the greater trochanter will be somewhere here, and this is how we put the transducer. In transverse view, in cut section, you can see the head is upward. This is the cut section of the bone, and then are the muscles. This is interior of the hip again. We saw this posture before. If there is effusion, for instance, in the hip joint, while scanning the patient transversely, we will get fluid in the joint. It can be seen in subtrochanteric bursa, and we can see the walls around the fluid. If we have well circumscribed walls, it will be in the bursa, or we can get some free fluid in the joint, which will be just effusion. Here is a case in which we were using ultrasound guidance, and here is the needle. This is needle tip within the joint cavity where we had some fluid, so we can aspirate fluid. This is needle which is going towards that. For mass in right anteromedial, this is the anteromedial aspect. We will be moving the transducer a bit medially, and here is the well circumscribed mass which was just below the hip joint at the anteromedial side of the thigh. We can correlate it. This is the MRI, the T1 and FSC. We can see the fat set MRI. Here you can see here is that lesion. This is the head of the femur here, and the mass is there in